So how do we manage projects? When we're working on projects, let's say it's a quality system project, usually the way we do that is we have a proposal, lines out when we're going to do the different implementation to the procedures. We come up with a list of procedures we're going to implement with a client, and then we typically will do one per week. So we'll have weekly meetings with a client. So if you're implementing 25 procedures, which is the minimum requirement for the FDA, they actually have 25 different procedures you need to have in a quality system. Well, that's 25 weeks, so it's going to take you about 6 months to implement your quality system. So that's how we manage a quality system project. For 510K submissions, we actually use a copy of the table of contents as our planning tool, and we color code it to indicate red, a document isn't created yet, yellow, it's in progress, and green, it's ready to go and to be submitted to the FDA. So we color code each line item, and then things that are missing, we try to write in red font. So you can just look at the table of contents and tell right away what's remaining to be done, because that's one of the most common questions I get throughout the 510K project is, what more do you need from us? And so if the client looks at the table of contents, they can tell real time, this is what needs to be done. These are the things in red. These are the things that are in yellow. These are the things that are done. And we even identify things that need to be signed by the client in blue. So we have 4 different colors we use to color coordinate the status of different items for the project. As I said before, we have red, missing, yellow, it's in progress, blue needs their signature, green ready to go, and we prioritize the task completion for the clients as well. Then over here, here's an actual example of a table of contents. So here, waiting for transfer, payment, and payment ID from the client. Here, it's in progress. As you can see, it's in progress. This is the actual table of contents. Need the payment ID. So this cover sheet actually has a place for the payment ID from this form to be entered. And then the 510K summary might be a draft, and it still needs a table from section 12. And if you looked further down here, section 12 would say what's missing is the table, it's not completed. So that's what we use as a training tool to help people understand where their project is and what's needed in order to complete the project.